Good afternoon. My name is Kenya Holmes Preston, and today I will be reviewing my strategic plan executive summary. This strategic plan outlines the long term priorities and direction of the organization. It serves as a guiding framework that aligns the organization's mission, vision, and operational goals in order to support sustainable growth and effective service delivery. By clearly defining strategic objectives, leadership can better coordinate resources, strengthen program development, and ensure that all departments are working towards shared organizational outcomes. The strategic plan also provides a structured approach for evaluating progress, identifying areas for improvement, and adapting to changes within the healthcare environment. Strategic planning is particularly important in behavioral health organizations due to the rapidly changing demands placed on mental health systems. Through intentional planning, leadership can proactively address ongoing challenges such as workforce shortages, financial constraints, and the increasing demand for mental health services. Additionally, the strategic plan supports improved coordination among programs, enhances collaboration with community partners, and promotes more efficient service delivery. Ultimately, these efforts contribute to stronger community health outcomes by ensuring that individuals and families have access to comprehensive, high quality behavioral health services that meet their evolving needs. A behavioral healthcare strategy typically includes a series of carefully identified priorities designed to strengthen the quality, accessibility, and sustainability of healthcare services. These priorities guide organizational decision making and help ensure that resources are directed towards areas that will have the greatest impact on patient outcomes and community well being. Key priorities often include improving access to care, strengthening workforce stability, ensuring financial sustainability, and using data driven approaches to enhance decision making processes. By focusing on these areas, behavioral health organizations can better respond to the growing demand for mental health services while maintaining effective and efficient operations. Improving access to care is a central component of any behavioral health care strategy. Many individuals face barriers such as transportation limitations, long wait times, lack of insurance coverage, or limited availability of providers. Strategic efforts to expand service capacity, streamline intake processes, and increase community based service locations can help address these barriers. In addition, workforce stability is essential for maintaining consistent, high quality care. Recruiting, training, and retaining qualified mental health professionals ensures that clients receive continuous support and that the organizations can meet increasing service demands without compromising care quality. Financial sustainability is another critical priority within behavioral health care strategy. Organizations must carefully manage funding resources, reimbursement models, and operational costs to ensure that programs remain viable over time. Effective financial planning allows organizations to continue providing services while also investing in program development, staff support, and community outreach initiatives. Community outreach programs in partnership with local organizations, schools, healthcare providers, and faith based groups can also play an important role in strengthening behavioral health systems. These collaborations help reduce stigma surrounding mental health, increase public awareness of available services, and encourage individuals to seek help earlier. Outreach efforts can also build trust within communities that many historically experience barriers to while accessing behavioral health care. Additionally, the integration of technology, particularly telehealth services, has become an important strategy for expanding access to care. Telehealth allows individuals in rural or underserved areas to receive mental health support without the need for extensive travel or long wait times. Virtual counseling, virtual counseling, psychiatric consultations, and remote care coordination can significantly improve reach and convenience for patients. As research suggests, telehealth technologies can effectively expand and access and improve continuity of care for vulnerable populations when implemented appropriately. Finally, the use of data and performance metrics is essential for improving decision making within behavioral health organizations. By analyzing service utilization, patient outcomes, and program effectiveness, leaders can identify gaps in care, evaluate the success of interventions, and make informed adjustments to programs and policies. This data driven approach supports continuous quality improvement and helps ensure that behavioral healthcare strategies remain responsive to the evolving needs of the communities they serve. A strategic plan must be a dynamic document, as essentially they are living documents. The leadership regularly shares the performance indicators, financial data, and results of services to ascertain progress. Stakeholder input towards strategy improvement. The ongoing monitoring helps organizations to adjust to the changing healthcare conditions and maintain the effectiveness of services, as well as strengthen a sense of responsibility, teamwork, and sustainability. Now we can get into strategic planning in a Christian worldview. Strategic planning is a stewardship and good leadership in terms of a Christian worldview. Organizations are called to serve people in a humble, dignified, and upright manner. It is planned to use resources in a wise manner, benefiting vulnerable populations. Ethical leadership, accountability, and service are in line with Christian values in fulfilling the mission of a healthcare organization. In conclusion, strategic planning allows starting point behavioral healthcare to strengthen its services, improve coordination, and build meaningful community partnerships by focusing on workforce development, integrating technology, and expanding community outreach. The organization can better respond to the growing demand for mental health services. Through thoughtful long-term planning, starting point behavioral healthcare can support sustainable growth while continuing to provide compassionate care, improving overall mental health outcomes within the community.